We are here today to celebrate a wonderful commitment to care in our community from our friends at Frontrunner. And I wanted to just take a moment to acknowledge those who are here on behalf of Frontrunner today. I don't think I'm going to get everyone, but I would just point out that Kevin and where did Stephanie go? Right, and I'm sorry, I know I don't have your wife's name, and I should.
Debbie is here.
Debbie, yeah, I thought it was Debbie. And Kelly and Caden are the babies. And then we have Ashley, Jason, and Jules. And I missed your son-in-law.
Joe.
Joe, okay.
I guess first of all, on behalf of Frontrunner, my family, and our entire staff, which through their hard work and dedication, this donation might not have been possible. So we're very proud and honored to be part of the Kingston community and the healthcare facilities and the great work that everyone does here. When we were approached, I had kind of a little special part in my heart, like 2 granddaughters. We had spent 4 months, and they were born a little premature, so we spent a good long time at the hospital and got firsthand of all the wonderful caregiving that happens within these facilities. So we were very moved and touched by that. So that was very helpful, for us. When we looked at everything, my background, I spent pretty much my entire adult life in funeral service. And as part of that, we decided that from the earliest of beginnings, we wanted to make a contribution of $50,000.
Oh, wow.
To the charity.
As I understand, you've split your commitment evenly 4 ways. So $12,500 is going to the neonatal intensive care unit, $12,500 to the obstetrics and gynecology program, where we have a vision for a slightly revamped configuration of space going forward, as we do for the NICU. $12,500 to the urgent care center at Hotel Dieu Hospital, and $12,500 towards Providence Manor.
So Kevin, I'm not sure if we met in the nursery or not, but this is a real privilege today to be here and to thank you on behalf of the team. I think you could do my job for me, just tell me about, or to tell people about what this generous donation will do for us. And I'm going to just apologize if I get a little emotional, but this is, I tend to get emotional in these things, but I have to say, seeing your daughter and son-in-law and your 2 beautiful granddaughters, who I spent many days with during their time, and it was a real, actually, privilege to look after them, and I was just reminiscing with Stephanie about how such an active and integral part both parents were, but Stephanie was always there on rounds every morning when I came around to see them, and to see them thriving has just been a thrill for me. But what I want you to think of, and this is a really personal thing for you, I can imagine, but imagine that if, Stephanie going into labor and then delivering those babies only to find that she would actually have to go to Ottawa or Toronto for them to be cared for. To add that degree of stress to any family when they're faced with what is. I mean, they look great now, but we do remember that we had some tough times through those months that they were there. So what you're doing is allowing other families as well to stay together when they're going through these difficult times. And so just as you're doing, I want to say thank you on behalf of all of those families. And the other thing that you just might not know, but I want to say is that I'm just one of the members of the team. Stephanie will tell you that I'm not in there as much as a lot of the nurses and the other people that are there. And they're unfortunately not the one up here to say thank you, but I want to say thank you on behalf of all of them. And what happens is that when we know that the community, and even probably even more special when people come back from who've been here to sort of say, you know what, this makes our job a little bit easier to get back to. And so the team is very encouraged by the fact that you guys are giving back to us. And that it helps us keep on doing what we're doing. So on behalf of all of the families that you're helping, and for the team that I have a big privilege to be part of and to speak for, I want to say thank you for your generosity.
So I'm very fortunate that I wear 2 hats. So the pediatric program, I get to see the benefit of your generous gift on the one hand, which Bob has so eloquently defined what it means to all of us. And then on my other side of my hat is the obstetrics gynecology program. And one of the things that this has been a great timely opportunity for us is that we are really looking at the opportunity to provide families more in terms of supportive care, but also the opportunity to have a lot of birth. And so one of the things that we are confined with is the environment that we sort of work in right now, in terms of not having water tubs available for women to have supportive water therapy while they're going through labor, but as well as the opportunity to, with certain providers, if that's their choice to have a water birth, that we are able to provide that opportunity for them. So this generous gift will help us in terms of achieving that dream for many of us who see that as the opportunity to support our families much better in the community. So thank you very much. I appreciate it.
Very much. On behalf of Dr. Gord Jones, head of the Department of Emergency Medicine, and Hotel Dieu and myself, I'd like to thank you for your generous gift. Hotel Dieu sees about 50,000 emergency urgent care patients per year. We work very closely with KGH Emergency as we're one program. And as we speak right now, the emergency department here at KGH is in gridlock, so it's very important that we're able to do our part in the urgent care center. And so your generous gift will be used toward much needed equipment. So thank you very much.
I want to, on behalf of Providence Care and Providence Manor in particular, thank you for the donation to Providence Manor. We are really honored to work with seniors at the end of their life. It's also a joy to see these beautiful grandchildren. But the whole connection of people in our community, part of these donations are going to help us build the best long-term care home in the city. And that's where we're focused, and that's really where my passion is to look at people at the end of their life and the things we can do to make their lives better. So thank you so much.
Thank you again, Kevin, and to the whole family. I can't think of a better family and a better gift and a better connection with what you've done to support all of our hospitals and how it connects to your family, right from the beginning of life to the end. So I think it isn't more fitting, and it's certainly a special moment that we're sharing here. And I get to bring thanks on behalf of the Board of Directors, and thank you for your support of the Circle of Life program, and all of our wonderful healthcare professionals have spoken about how it will uniquely touch their area. But for us as an organization, our board the foundation was structured so that we could focus on the way patients are cared for. And this gift is certainly touching on how the gift will be spread. And it just makes sure that our wonderful healthcare professionals, some of whom are in the room, are going to have more resources to do the work that they're passionately doing every day and with great care. So this gift will help us propel to the Extraordinary People Innovative Healthcare Campaign. Our goal is $65 million, and we announced that on Friday, and this is one of the many steps that will take us there. So thank you very much for your donation. To all of you, especially the girls who came in attendance, what fitting guests we have to help us celebrate the Circle of Life in your donation. Thank you very much.